Why is lasting weight loss so elusive? Why is lasting weight loss damn near impossible? I know you sitting there watching this can probably tell me that you've probably tried and lost and regained weight more times than you can think of. There's a reason why the literature backs this fact up, that lasting weight loss is damn near impossible. Hi, my name is Dr. Jones, and I have clinics that service across the nation, and we have an extremely successful approach towards lasting weight loss. Notice how many times I'm saying the word lasting. There's a reason for that, because losing weight to me is such a small piece of the equation, but being able to keep it off for the rest of your life, that's exactly what we focus on. And we use powerful aids like semaglutide, Tirzepatide, GLP-1 medication, but we combine them with powerful fat mobilizing peptides so that we can use them and help our patients get into deep lifestyle interventions that focus on sustainability. So you will be able to do this for the rest of your life. I can guarantee that. This webinar that I made is going to break down and get into all the various pieces of that. So enjoy.
Hey guys, Dr. Jones, DC, Colorado Medical Solutions, and this is the much anticipated part 2 of the weight loss webinar. So you are probably in two different scenarios here. You found us off TikTok, but you either are waiting for your first consultation, so you've just finished that first webinar and you've got both of them sent to you, so you're watching this. Fantastic, this is gonna fill in the gaps for everything that we needed to have on that first webinar. Or maybe you've already had a consultation or two with my staff and you've been instructed, as you're trying to figure out whether or not this is the right option for you, you've been instructed to watch this video as well. Either way, guys, welcome, welcome. Let's dive right in. So let's talk about Tirzepatide really quick. So Tirzepatide, or Mounjaro, is the next generation from semaglutide or Ozempic Wegovy. And so all the things that you learned about in the prior video about semaglutide in terms of its mechanisms of action are at play with Tirzepatide, but Tirzepatide is better. It's the next generation. It has a stronger effect. The reason for this is because Tirzepatide doesn't only just act on the GLP receptors, but it also acts on the GIP receptors. So it has a dual mechanism of action. And this is why patients report not only better appetite suppression and shutdown of that food chatter, but additionally, it also has a better side effect profile, guys. So we pretty much don't use the semaglutide at all, and we focus on Tirzepatide in combination with the AOD 9604, of course. Okay, now let's talk about the FLOA Protocol, FLOA, fasting like our ancestors did. This has been my work. This has been my baby, my project for the past decade. From my last video, you learned about my struggles for the decade prior to that, before I even became a functional chiropractor, and know what a struggle it was for me and how I discovered prolonged fasting and how to use it in this format for me to be able to personally manage my weight. And then over the last 10 years, working with patients. And even when I was at the gym format, managing gyms before I became a chiropractor, fasting was such a powerful avenue that we did with our clients back then. And, so it's just been one thing after another. But working with patients is when I really started to see, gosh, not just for weight management, but freaking reducing inflammation. And talk about just about every issue a patient's gonna end up in my clinic for is usually related to inflammation, and lowering their inflammation, improving their healing, improving their insulin resistance, are all things that they need in order to support whatever treatment they were in my clinic for. And so fasting has always found its way to be essential for whatever it was we were doing, but for why you guys are here, it is the most potent way to accomplish successful long-term weight loss and weight maintenance. And so in the world of prolonged fasting, what I put together was the format. This is the most aggressive format of prolonged fasting that exists. I didn't invent prolonged fasting. It's been here for a long, long time. It's what our ancestors did. It might sound wild and crazy, the concept of fasting for 48 hours every single week to accomplish your weight loss. Guys, that's not what I'm asking you to do for life. That's what I'm asking you to do in the program, and we're gonna talk about that in a little bit. And so by today's standards, it seems pretty wild and crazy. But if you think ancestrally, it's really not that wild and crazy in terms of what our ancestors had to do in order to survive and make it to this point, probably fast for even longer. So this is the most aggressive format for prolonged fasting, and I was just the first person to put it together in this format so that it can be utilized. And one of my long-term goals is to be able to teach this to other doctors so they can help their patients achieve the level of health that we have been successful at helping our patients accomplish. Okay, so now GLP-1 medications. These are the flashy new answer that people like to think is the answer to their weight loss woes and their weight loss struggles. And look, these GLP-1 medications deserve a lot of attention because I'm in agreement. They're the most potent medication we have ever seen in terms of strength to safety profile. No disagreement that I have for anybody here. But why I like to exercise some caution here is because, frankly put, we don't have long-term safety studies on these medications yet. Yes, they are FDA approved, but how many times in the past have we had an FDA approved medication that unfortunately we had to find out the hard way probably shouldn't have been? And so what I do know for certain is that staying overweight, whether you're obese or almost obese or 15, 20 pounds or more overweight, that will kill you faster. And we're not waiting for research to prove that. We already know that. And so for me, it's a no-brainer. If you've struggled in the past with your weight, then approaching these medications, at least in my opinion, from our perspective, which is short-term usage, I think is the greater good. And that's what we're accomplishing with our patients is short-term usage of these medications so that you can wean off. And look, this goes completely against the grain. If you found us on TikTok, you probably have seen and have yet to see other clinics making the claim that that you can do this, because what the literature shows, and again, I don't need literature, I just need common sense. When you take a powerful appetite suppressant and when you stop it, your appetite comes back and so does the weight. And so this concept of what we're accomplishing, no, we don't have literature to prove to you what we're saying, so we're never making that claim. But what we have been seeing and our theories behind why our patients are successfully weaning off the medications and maintaining their weight is because of the changes, the massive amount of changes that fasting 48 hours per week till you hit your goal. Imagine you got a 50-pound goal or a 150-pound goal. We're talking about 3 months to a year that you're going to be doing the FLOA protocol. There is so much change to your physiology when you fast this frequent for that long that, to me, it's kind of a no-brainer that you're going to be able to get the changes, specifically metabolic flexibility, that will allow you to maintain it, guys. So the FLOA lifestyle is where we are trying to get you guys. And so the FLOA protocol is the fasting 48 hours. And by the way, guys, we can sometimes work with our patients up to a 72-hour fast per week. That's the maximum that I recommend. So when you work with your health coach, we'll go back and forth and try to figure out which is the best for you. But the aggressive round of fasting, 2 to 3 days per week till you hit your goal. So the FLOA lifestyle is the end of the journey, guys. So you're here and we're trying to get you to this journey, and the FLOA lifestyle is what I envision as the key to maintaining your weight. And the key that we've been missing is regular rounds of prolonged fasting. So our patients are advised to do a 48-hour fast once every 2 to 3 weeks, or a 3-day fast once every 3 to 6 weeks. So this is what you're gonna have to play with, right? Because everybody's different in terms of how much exercise they're gonna be doing, how perfect or good or not perfect or good their diet is. And you should be doing your best to have a good exercise regimen and to have a good diet and not indulge too much or overindulge. But you've been trying to do your best in that category for however many years. And so what we're doing with this FLOA lifestyle is providing some wiggle room, or a lot of wiggle room, for you to not be able to, number one, for you to be able to just do it and maintain it. But for other people who can, but don't want to have a life that's centered around staying in shape, because that also sucks too. And so whether you have to do it for that reason, or whether you want to do it for that reason because you want to have some wiggle room and enjoy a life, and maybe be able to afford to have a little bit of wiggle room and enjoy having some of those foods every now and then, I think that the FLOA lifestyle is what you've been needing because it's so aggressive. And we talked about in our last videos, when you look at the numbers and the amount of calories that you burn from a 2-day fast, let alone a 3-day fast, it makes logical sense why our patients are maintaining that weight with so much more ease, guys. Okay, so in summary, the FLOA lifestyle, you do this long fast regularly for the rest of your life. Not only are you going to maintain your weight with much more ease, but you're also going to maintain, in my opinion, a higher level of health, because inflammation and insulin resistance are probably the two biggest forefronts of disease pathology, disease process, and regression from optimal health. If you're at optimal health, your insulin sensitivity is high, you don't have resistance, and your inflammation's under control. That is what we're striving for. And the moment you begin to become too inflamed or too insulin resistant is the pathway towards losing optimal health. So how do you stay there? Once you get there, it's the regular rounds of fasting. How the heck are you ever going to become resistant to insulin if every 2 to 3 weeks you're doing a long 48-hour fast, or every 4 to 6 weeks you're doing a 3-day fast? This is much more aggressive than anybody has ever recommended, but I think this is the missing piece to optimal health. And so insulin resistance stays at bay. You never, in my opinion, become resistant. Again, I don't have literature to back this up. This is my observation with common sense and understanding the mechanisms. Nobody has ever studied this, so you're gonna have to draw your own conclusions, but understanding the mechanisms of insulin resistance, how the heck would you become resistant if you're doing fasting like this in such an aggressive format? And really quick, in case you don't understand what insulin resistance is, it is a condition that stems from chronically elevated insulin. The cells on your body do not respond to insulin anymore due to chronically elevated insulin. Well, what causes chronically elevated insulin? Chronically elevated blood sugar. And what causes high blood sugar? Eating too many carbohydrates or eating too frequently. So what is the strongest form of fasting, which would be the opposite of both of those, right? Which would be the no carbohydrates and no eating at all, which would lower your sugar and lower your insulin levels. The strongest version of fasting is what I created, guys, the FLOA Protocol. So you can see where I'm going with this and why the FLOA lifestyle, in my opinion, is essential for almost everybody to maintain optimal health and maintain their weight. Okay. Getting you really, really excited, hopefully, about what lifestyle is gonna look like and what life's gonna look like when we get you there. But we're not there yet. We're here. Especially, you're probably thinking whether or not you wanna take this journey with us. And so now let's talk about that. I like to use the analogy of a bike ride, okay? So imagine you're a kid first learning how to ride a bike. You need training wheels, right? Our program is the training wheels for that bike ride. So whether you got 50 pounds to lose or whether you have 200 pounds to lose, what we know about you is you have excess inflammation and you are insulin resistant along with the weight that you need to lose. And so whether you have 50 pounds or 200 pounds, that's gonna be a 4-month to a 12-month journey. You don't need training wheels with us the whole time. A kid does not need training wheels to be able to learn how to ride a bike, and you may not want to work with us or need to work with us for that long. Now, don't get me wrong, I have patients all the time that come in with us and say, Dr. Jones, here you go, finances are under concern. I'd love for you to just take me all the way there and help me transition. And so we are happy to help you there. But for the rest of us that don't have unlimited financial resources, the minimum amount of training wheels that I recommend that you need, that we won't even do less, is 2.5 months, 10 weeks of the peptides, allowing us to fast for that 48 to 72 every single week, get about 8 to 10 rounds. If I can get a person to fast for that long, which is what we do in that program due to the help of the peptides, they get enough metabolic flexibility, meaning they have enough ability for their body to mobilize the fat fast enough to meet their energy demands, so that when we rip the training wheels off, the program's done, no more peptides, they're not at their goal yet, they can continue that journey, that bike ride. Imagine that kid again, training wheels are off. It's bumpy, right? They're not good yet, but they've had enough help to where they can keep it going. You have enough improved metabolic flexibility to where, look, the hunger is going to increase. The food chatter is gonna come back a little bit. But what I'm proposing to you based off the mechanisms and the changes in your body from fasting the past 10 weeks is that it won't come back as much because you have improved your insulin sensitivity, AKA you're not as resistant, your cells are not as starving for as much energy because of what you did with our help and the peptides for the prior 10 weeks, guys. So this will be something that you can work out with your coach, but I wanted you to have a clear understanding of the mechanisms involved behind what we're accomplishing here and how the program helps, and more importantly, how long you want to work with us for. Okay, so we understand the FLOA lifestyle. We understand that we are at the starting point right now, and we want to get to the point where we can accomplish the FLOA lifestyle. And it's the protocol that's gonna get us there. And all you need to do is figure out, A, do you wanna work with us? And B, for how long you wanna work with us. And as I said, and as I mentioned, you can go ahead and discuss that with your coach on your next call. Okay, so let's say you wanna work with us, but you are not medically cleared for the GLP-1 medications due to family history of thyroid cancers or active pancreatitis, or maybe you don't want to. I respect that. As you know, my opinion is I don't want anybody to be on it long term. So definitely we work with patients who don't want to be on the GLP-1 medications at all. So our go-to for appetite suppression to help us get into that rhythm of the FLOA protocol is tesofensine. Tesofensine was originally developed as an Alzheimer's medication, and they found out that it was amazing at helping people lose weight. Tesofensine is a triple monoamine reuptake inhibitor, guys. Essentially, that's just a really fancy way of saying it increases your levels of dopamine, serotonin, and norepinephrine. This is really, really important because it is not as strong as the Tirzepatide, guys, so it is a drop for us if we can't utilize the tesofensine. Additionally, let's say you can't get on the tesofensine because the contraindication of that would be being on a SSRI medication or some sort of antidepressant medications, which you'll talk to our provider about that. And so let's say you can't take that either, or you don't want to. We have plenty of patients that do AOD only. Now, AOD only option is going to be mentally the hardest and downright impossible for people that have a higher amount of insulin resistance. So it is definitely something that we always recommend that we can get some sort of appetite suppression that is going to just make it easy so that you can plug and play into your lifestyle, and whether that be the GLP-1, the Tirzepatide, or whether that be the tesofensine. Let's get one of those there to help you with the appetite suppression so that this is less stressful and we can almost guarantee that you're gonna be successful in this program. Okay, so we also do a comprehensive blood panel in the beginning. It's very important to understand that thyroid plays a huge role. We don't talk about thyroid that much, but we're assuming the thyroid's great. And if it's not great, we have to additionally handle that. Your program includes thyroid management if it's something that the provider recommends for you. And so we don't just look at the TSH levels. I have videos on this, guys, on my TikTok page, but essentially the TSH is not the actual true indicator of your thyroid levels. It's a precursor. It's not really a precursor, but it's a hormone that the brain releases to then tell the thyroid gland to stimulate and produce your thyroid hormones. And so it's relatively accurate of our thyroid levels, but there are plenty of patients who have a TSH that's normal, and if you actually check their free fraction hormones, are not normal. So our functional thyroid panel includes free fraction thyroid hormones, free T3 and free T4, and another one called reverse T3. You guys can have even normal free T3 levels and still have low thyroid symptoms because reverse T3 is a completely different marker that will block the receptor sites for T3 hormones. And so it's important if you have a high T3 that you are simultaneously working on that. And all of this is included in your program, guys. So I just wanted you to know that we are taking a comprehensive approach, especially with your thyroid, so that we can ensure that you are going to be as successful as you possibly can in the FLOA protocol, working with my coaches. Guys, finally, I want to end with the guarantee. So the guarantee is this: if you don't get the results that we are regularly getting with our patients, so if this is the first time you're hearing this, 1 to 1.5% of body weight loss per week, then we will continue to coach you for another 2 or 4 months relative to what you signed up for to help you get more results, because we are that committed to you. And quite frankly, it just doesn't happen that often. And so I wanted to leave you with that note. I wanted to encourage you that whether this is something that you do want to do and maybe it's just not financially the right time, whatever it is. I hope that this helps you become as most informative it is, and I hope you make a decision that's gonna be the best for you. And truthfully, I think this is the best format for aggressive, health-improving weight loss that's gonna set you up for success so that you can keep it off and stay healthy for the rest of your life, guys. Well, this is Dr. Jones, DC with Colorado Medical Solutions, and we'll see you guys later.